Namaste, my name is Amish Tripathi and I'm the director of the Nehru Centre, London. Now, some may think of Nehru Centre as just this beautiful fine building, and it is a fine building, no doubt. We have a wonderful art gallery out here. We have an awesome auditorium on the first floor with a capacity of 100 to 120 people right here in the heart of central London in Mayfair. But the Nehru Centre is a lot more than this fine building. The Nehru Centre is also an online platform. We are available on Twitter, on Facebook, on Instagram and on YouTube. And so the Nehru Centre is actually wherever you want it to be. Of course, we'd love for you to come to the physical events that we organize out here when we do organize them. But do join all our online platforms as well. This is a hybrid world. We are going to have offline physical events and online events as well. So do join our online platforms and do keep giving us feedback of what you think of it. We'd love to host you out there. We'd love to hear what you think of our events, and do keep sending in your suggestions as well. We do keep imbibing and learning from the feedback that you give to us to give you programs that you guys might enjoy. Thank you so much for your kind attention. Namaste. Jai Hind.
Namaste. Namaste, can I go ahead?
Yes, please go ahead.
Yes. Namaste. I am Dr. Prakash Hegde, Dean Academics and head of the Department of Dravyaguna, that we call it as Clinical Pharmacology of SDM College of Ayurveda and Hospital, Hassan, Karnataka, India. So right now I am chairman of Pharmacopoeia Committee of India, and to say I'm a clinician for 20 years now. Specifically, I am dealing with diabetes mellitus, what we call in Ayurveda it as Madhumeha, one of the dangerous disease which is afflicting mankind at present day. So it's very important that to know and learn about various aspects of treating so many diseases which are dealt in Ayurveda. It's my hobby and my passion also. I would like to thank the organizers for giving me this opportunity to share my knowledge regarding Dasa Vidha Pariksha, the 10 factors which are very important to assess health of an individual. So I think I would start. Like to acknowledge everyone who has joined online and watching this presentation. The topic which I am going to deal is Dashavidha Pariksha. That those are the 10 factors which are used to determine the state of health of an individual. As you can see the slide, um, it's very important to assess or to check, to evaluate anything to achieve something which is good. So always we have an aim to achieve something. So to achieve those things, we need to have certain parameters. Like it may be certain step-by-step parameters which are helping us to achieve the goal. So in the same way, when we are treating certain diseases in Ayurveda, so we need to examine the patient. So those parameters we call it as Dashavida Pariksha. So those are the 10 parameters or 10 factors. So here the 10 factors, it's not only applied to the patients to assess, it can also be effectively applied to healthy individuals too. So, what are those Dashavida Parikshas? How we can assess our health? What are the steps which are involved in it? How we can come to a conclusion, the status of health of an individual? Such things will be knowing today. What are Dashavida Parikshas which are explained in Ayurveda? In Charaka 8th chapter, it is very nicely mentioned that Tasma Dhaturam Pariksheta Prakrititascha Vikrititascha Saratascha Samanatascha Pramanatascha Satmyatascha Satvatascha ahara shakti tascha vyayama shakti tascha vayas bala pramana vishesha grahana hetohu. Like that, these are the unique and essential 10 factors which are helping in knowing health status of an individual. Moving further, so what are these dashavida parikshas and what it means? Those are prakriti, so that can be understood as body constitution. Then vikriti, it may be disease or morbidity. Then sara, that is excellence of dhatus. Then samhanana, compactness of organs. Pramana, that relates to physic or a stature. Then satmya, that is homologation. Then satwa, that is mental condition or mental faculties. Ahara shakti, power of ingestion or power of digestion. Then vyayama, strength to perform various exercises. And finally, vaya, that is age. So these are the 10 factors which we need to assess in each and every individual to know the status of his health. What is the background actually here? So we know there are various tools which are explained in Ayurveda to assess health status of an individual. Among them, one is this Dashavida Pariksha. This is very important and very effective parameters. Effective in the sense which gives us almost accurate information regarding the health status of an individual. So with the help of these 10 parameters, which are having various factors in it, which are related to health, which can be it can be evaluated. So moving further, what the reference which we have, which says Aturastu Kalu Karya Deshaha. So here in Ayurveda we say whom to exam. So that is the question which is asked. So here which is very clearly said in Charaka 8th chapter, that is Aturastu Kalu Karya Deshaha. That means whom to examine here, that is we have to examine an atura, that is a patient. So what to examine here? The lifespan of an individual or the strength of that person or the patient and the extent of vitiation of doshas or the factors which are involved in vitiation. So what we call it as extent of vitiation of doshas. Then why we need to assess all these things? Very important thing is dose of medicine. To have a calculation regarding dose of the medicine, all these 10 factors are important and various other aspects also will be learning in the next slides. What happens if we are not assessing all these 10 factors in a person or in a patient? So here, as I said in the previous slide, it's very important to know about these 10 factors to advise particular dose of medicine. So here, administering strong medicine to a patient having less strength, then what happens? He can't tolerate the strength of the medicine. So once, what are the types of medicines which he can't tolerate? Even the person is having less strength, like Tikshna Aushadha. So the medicines which are having very strong potency, it cannot be uh, tolerated by the patient or a person. Then Agni Karma. So if you are performing any cauterization or anything like that, the patient should have good strength. Then only you can plan for it. Then Kshara Karma. So alkali treatment. So that also needs the strength in a patient. Then finally, Shastra Karma, that is to perform surgery, we always have to assess the strength of an individual. So if we are not assessing all these things, then what happens? It may lead to so many morbidity also. Finally, it may lead to death too. That's why it's very important to assess the strength of a person. So, a first point which we need to learn about among Dashavida Pariksha is prakriti. So as we know, prakriti refers to body constitution of any individual. So there are various body types are told in Ayurveda. So they are seven in number, like Vata, Pitta, Kapha, Vataja, Vata Pittaja, Vata Kaphaja, Pitta Kaphaja, and finally Tridosha. So these are the seven types of body constitution which are explained in Ayurveda. So what are the different features of these things? So if a person is having Vata Prakriti, then he'll have the characters like creativity, energetic, adaptable, spontaneous. Immediately he'll respond. Then good communicator. Then what are the features of a person who is having Pitta Prakriti? Intelligent. Then he'll be sharp. He'll be organized. He'll be warm and friendly. And he'll be a leader. These qualities will be there in Pitta Prakriti person. Then if a person is of Kapha Prakriti, then he'll be always calm, he'll be stable, he'll be grounded, very humble. Then he'll be having strong endurance and he'll be caring. So I have told about seven, like combination of two. For example, Vata Pitta. Then he'll have certain features of both this Vata and Pitta. From this slide, you can observe that. Then the person is of Pitta Kapha, the features of both Pitta and Kapha will be there. Then if it is of Vata and Kapha, then the features of Vata and Kapha will be there in a person who is having Vata Kaphaja Prakriti. So then what about Tridosha? So all in this Tridosha, all these three will be the features which are present in a person. Then moving on to the second point, that is Vikriti Pariksha. So among 10 factors which are mentioned in Charaka Vimanasthana, Dashavida Pariksha, second point is Vikriti Pariksha. So here Vikriti refers to Vikara. So here Vikara means the diseases. Various diseases are to be examined by having an understanding of these points, like Hetu, that is causative factor, dosha, that means thing factor which is involved, it may be pitta, kapha, like that. Then dushya, so there are seven tissues which are there. So what are the tissues which are involved in particular disease has to be examined. Then prakriti, that is nature of the disease. Then desha, desha means where the person has got this disease, that is desha. Then kala, kala means which season or which time the person has got this particular disease, that is also very important. Then bala of a person, or here it can be vyadhi bala or it can be um, rogi bala. So vyadhi bala means the strength of the disease and rogi bala means strength of the person. Then visheshalinga, that means any special characteristics which are there when it comes to the particular disease. All these things are to be examined in a patient. So that's what it has been mentioned in our classical text. So here, Hetu already we know causative factors. So here, why we need to learn all these things means we all know that to have a protocol, a treatment protocol, we need to have certain parameters. So here, we need to advise the patient or the person to avoid such factors which are responsible for manifestation of particular disease. That is understood as Hetu here. So by intake of certain uh, maybe food items or by doing certain activities, the particular dosha which will be aggravated, then finally it leads to particular disease. So what is responsible factor, no, for the manifestation of the disease? It has to be understood. So once we are treating any patient, it's very important that we need to advise the patient to avoid all these causative factors. That's what it's very important. If all these factors are studied, no, which gives us an idea what is the severity of the disease and what is the prognosis of the disease. All these things can be understood by assessing all these factors. Moving further, we discussed about Vyadhivala, that is the strength of the disease which has afflicted a particular person. So here, to assess any vikriti, we need to know about like how severely it is affected. If the disease has got severity, That means the things which are explained previously have affected severely, then we can consider it as Mahabala. Means the disease strength is very strong. That means we need to plan for a treatment which is very strong. Then moderately affected means it can be considered as Madhyama Bala. So moderate it is. So we need to plan for moderate strength of the medicine also. Then it is less affected. Then we can administer the medicine which are having less strength. Then moving further, the third pariksha factor is sara pariksha. That is excellence of dhatus. That is tissue. So here the sara, the word meaning refers to purest form of the dhatu, which are of best quality. Okay. So here the dominant dhatu or tissue with respect to good quality, which is considered for assessment. So here it involves physical, physio-psychological characteristics of different sara which are reflected based on the dhatu sara. So here we need to know what are the types of sara. So we have the reference regarding Ashta Sara Pariksha. That means 8 types of Sara. So Sara means excellence of dhatus. So here they are Tvaksara, Rakta Sara, Mamsa Sara, Medo Sara, Asti Sara, Majja Sara, Shukra Sara and Satwa Sara. So these are the 8 saras. One thing you can easily remember here is there are Saptadhatus in Ayurveda: Rasa, Rakta, Mamsa, Meda, Asti, Majja, and Shukra. Among that, in the place of Rasa, Tvaksara is mentioned, and at the end, Sattvasara, that is mental strength, is also added to this. So, like how there are 8 types of Sara, each Sara is given certain features that has to be examined. So, what is the significance of Sara Pariksha? Why we need to carry out this? So, here Sara is to assess Bala of a person. Okay, the strength of a person can be understood or assessed by assessing the Sara. Here, 8 Saras we all know. The number of Sara which is having more strength, no, that is directly proportional to the strength of an individual. Suppose all 8 Saras are dominant in a person, then the person will possess maximum strength. So this Sara Pariksha, it is not only for the patient here. Okay, so this Sara Pariksha can be done with a healthy individual also. Even healthy individual have Pravara, Madhyama and Avara type of Sara. Moving on to the next Pariksha, that is Samhanana Pariksha. So here, Samhanana, generally let us understand it as a compactness of the body. Okay, like how our body tissues are having compactness. Based on that, we are assessing the Samhanana Pariksha. So here, Suibhakta Asti is mentioned. That means well demarcated bones. Then Subadha Sandhi, that is the word which is used that refers to well developed joints. Then Sunivishta Mamsa Shonita, that means well bound muscles and blood. So if these things are there in a person, then we can categorize the person as Pravara Samhanana. Okay, like that. So what is the relation between this samhanana, that is compactness, uh, and versus bala, that is strength? If a person is having susamhata, that is well built uh, or compactness of the body, then the person will possess uttama bala. So that applies to common healthy individual also, right? Uttama bala means good strength. If the person is having madhyama samhanana, that means moderately built, then madhyama bala, moderate strength will be there. Then alpa, that is poorly built, with respect to the 3 points which are told, that is suvibhakta sandhi, then shonita and gatra things like sunimeshta mamsa shonita, suvibhakta asti, all these things has to be considered. Then what are the types of samhanana and what are the features? So this table, no, which gives us very clear picture. So what is the exact difference between pravara samhanana, madhyama samhanana and avara samhanana. So if a person is having good compactness in a body, then we categorize it as pravara. If it is moderate, it is madhyama. If it is poor, then it is avara. So what are the features which are told under pravara samhanana? That is symmetrical and well demarcated bones, then well developed joints, well bound muscles and blood, strongly built, good strength. Okay, the person who is included under pravara samhanana category, that is one among 10 factors, then it helps us to categorize him and as the person will be having very strong strength or good strength. The same thing can be applied with madhyama, that is all these points no, which are discussed previously with pravara samhanana, all these things are moderate in nature. Then avara samhanana means it is weak or poor. So avara samhanana person will have weakly demarcated bones, weakly developed joints, weakly bound muscles and blood, weak or poor built, weak strength, like that. Then moving on to the next one, that is pramana pariksha. So it is stature or measurement. So what are the things which are included under this pramana pariksha? That is sharira pramana. It's the stature or measurement of bodily organs or total body. So what are the points which are included under this pramana? It is measuring height, measuring length, measuring circumference, and measuring breadth. So of different organs by angula pramana. So here angula means it refers to the person's one phalanx, that much distance is considered as angula. Angula, it differs from one individual to another individual. So here the person who is to be examined, no? So that particular person is considered. What is the importance of this pramana pariksha? Here we have certain important personalities like ati stula person, ati krisha person, ati dirgha person, or ati sasva. What it means? Ati stula means it is nothing but obese person. Ati krisha means the person who is lean. Ati dirgha means one who is tall. Ati hrisva means one is dwarf, like that. So why we need to learn about all these things? Because atistula person will have so much of discomfort, then he'll always looking for more quantity of food items, that we say atimatra ahara, he'll like and he'll have it, and he will have so much of difficulty in performing any exercise. He'll be commonly prone to different diseases pertaining to kapha dosha. Okay, the disease of kapha dosha. That's why to categorize a person under atistula, we can easily assess, okay, this person is going to have kaphaja disease in future. So that is the importance of this. Then atikrisha can be categorized as lean or emaciated. So atikrisha person usually have heenabala, that means less strength. He'll again prone to vata vikara, that is the diseases of vata dosha, and he'll have very less immunity. So if we examine a person based on pramana, if we categorize the person under atikrisha, then we can easily assume or you can predict that the person is going to be having vataja vikaras, or he'll suffer from so many immune related issues. Then what is the significance of this pramana pariksha? Why we need to do? So the stature is very important factor, especially in deciding the dose. It's very well known that if a person is having big stature, then he'll have increased body surface. Then he need more dose. The dose will be more when you are administering the medicine. So another very important thing is male patients always having more body surface because of his nature. Naturally, females have less body surface than males. Then children. That's why we are giving administering very less dose among female and even among children. Moving on to the next pariksha, that is satmya pariksha. So satmya, homologation is the word, but how easily we can understand this, which stands for the factors which are wholesome to the individual even when continuously consumed. That means, see, we always say like we need to avoid more of fat contents, fat items, or oil items. But some person will be accustomed to those items. So that is very important factor we need to ask when we are examining or we are assessing any person. What is the significance of this Satmya Pariksha? So usually it is understood that the people who is accustomed to ghee, milk, oil and meat soup, they'll have more strength generally. Here, if the person is having more strength means definitely he can withstand the difficulties and he can have very long life span. So it's important to know about the Satya Pariksha. Then one more very important thing here is when it comes to treatment side, the person who is accustomed to grita, what we say ghee or the oil, he may have a satmya to snehapana. Snehapana means giving particular oil or ghee to a patient. So in that time we need to administer him more quantity of this oily items, which we say prepared ghee or processed oil to perform any type of panchakarma therapy, that is vamana, virechana, all those things. We are administering the patients so many types of gritas. This Satma Pariksha, which stands for such factors which are wholesome to the individuals when it is consumed continuously. If the person is having a habit of taking more of ghee, milk, oil, and meat soup, definitely he will have more strength and he'll have more power and he'll have long lifespan. Naturally, if the person is opposite to this, like the people who is accustomed to any dry substance or taking only one particular taste in a day, will definitely have less strength or he'll have less power and he'll have short lifespan, may have so many disease also in future. So what is the importance here when it comes to assessing health of an individual? So when you are asking, interrogating with the person, then you need to ask what are the common things which you are taking regularly. So if you are getting the information as like he's taking one particular type, like maybe he's taking only sweet items every day in large quantity, definitely he'll have kapha the related diseases in future. Okay, so the person who is taking more of bitter taste substances or more of dry things, definitely he'll suffer with uh, vataja diseases. It's very nicely explained in our classical text. So what are the types of satmya? So it is uttama satmya, madhyama satmya and alpa satmya. These are the three types of satmya which are explained in our classical text. So what do you mean by uttama satmya? Uttama satmya means sarvarasa satmya, means the person will be consuming the food items uh, which are having all that six taste in it by different in methodology, maybe having sweet items, mixing little salt content, sour in it. So all takes six types of taste. If it is consumed on regular basis, definitely he'll have good strength and we categorize it under uttama satmya. The person who is having uttama satmya, he can become klesha saha, that means he can face any difficult situations. Then same thing applies to madhyama satya. It's on moderate strength. So there are six tastes which are explained in our classical text. So if the person is taking uh, one day or 6 days, sometimes he leaves or he takes only few days, like that it can be considered under madhyama satya. He'll have madhyama bala, that is moderate strength. Then when it comes to alpa satya or avara satya, that can be categorized under alpa satya like ekarasa. which is the person who is taking only one taste items in a day. So definitely he cannot withstand any pressure, or he can't face any difficult situation. Then moving on to the next one, that is satwa pariksha, that is examination of psychic conditions or mental faculties. So satwa, based on the characteristics, so we can categorize this satwa pariksha into three categories. They are pravara, madhyama, and avara, as like in previous parikshas. So pravara we can classify it as strong mental faculty. The person will possess very strong psychic conditions. Then madhyama refers to average or moderate. Avara refers to low. So pravara, as we know, it is the person is having very strong mental strength. So the person will possess excellence of mental faculties. Then the person will having satwa sara, so which are mentioned under sara pariksha. So here the person who is having pravara satwa can tolerate any serious exogenous or endogenous disease, even though they have weak physique. Okay, so it's very well said, commonly under said thing, that if a person is having more of mental strength, he can overcome any difficult disease in his life. So the same thing applies like madhyama, that refers to moderate, so which is influenced by looking at other people. Like if he sees somebody else, then he thinks, okay, I need to adopt such things in my life, then he'll adapt. So those type of people we categorize as madhyama sattva people. So he can tolerate pain when they realize that others can also tolerate. Means by following others, like how others are doing the same thing, they feel, okay, I can also do it. Then coming on to the avara, that is poor. Here we can say it as the person who is having very weak mental strength. He cannot be influenced, like if he watches other also, or if we give examples of so many other people also, he cannot be influenced. And he can't tolerate even the mild pain also, because his mental strength is very poor. In this context only, like how we discussed previously, if the person is having very strong mental power, he can withstand any difficult conditions, or he can overcome so many dreadful diseases, because his mental strength is good. On the contrary, if the person is having very poor mental strength, he cannot even tolerate mild pain, even though he's heavily built. So generally he'll be susceptible to fear, grief, greed, delusion, ego, or any other terrifying situations. He again normally falls victims to depression, fainting, madness, and giddiness. So moving on to the next pariksha, that is ahara shakti pariksha. We say it as power of ingestion and digestion. So that is, power of ingestion means the one's capacity for intake of food. Like what is the quantity of food the person consumes. Based on this ahara shakti, we can understand there are two facts. One is power of ingestion, that is how much, what is the quantity of food the person can uh, consume, and power of digestion, that is what the quantity of the food he'll be able to digest. So this is very very important to assess, because see here, whatever may be the disease, it's mainly because of indigestion, we commonly say. If the person is possessing very good digestion or very good digestive power, he can digest any thing also. So it doesn't, he doesn't allow to have any type of ama, that is indigestion or any toxic substance in the body, so that he'll be very very healthy always. So that's why it's very important to know about the power of ingestion and power of digestion. So, ahara shakti pariksha here. What are the things which are included under this ahara shakti is abhyavaharana shakti and jarana shakti. So, abhyavaharana shakti refers to the power of ingestion, abhyavaharana, that is power of ingestion, and Jarana Shakti refers to power of digestion. So there are certain factors which are also very important when we are asking about or taking some information from the person. So what kind of the food he is consuming regularly, whether it is light food, what we say lagu, or whether he consumes heavy food, whether he consumes properly cooked food, or it's only half baked food he is consuming, or what are the ingredients of the food preparations, consumption habit, that means whether he is adding something else while taking food, maybe by adding a ghee, whether he may take the food, or without adding ghee he is taking, or anything else he is consuming before consuming the meal, etc. Because people have various habits, like consuming something else before having or before going for main meal. Such things are commonly practiced. So this is very important point we need to assess in every individual, that what is the food habit, because we are facing so much of lifestyle related disease, including diabetes or hypertension. So we all know that it is mainly because of our food habits and the daily routine which we are adopting in our life. So such things can be definitely avoided if we are going for such parikshas. Then vyayama shakti pariksha, that is the power to perform exercises. The person has to be examined based like with respect to power of performing exercise, because it gives us an idea what is the exact strength of a person. In Ayurveda it is like ardha shakti vyayama is mentioned. That means a person should know while performing the exercise that till his half strength only he has to perform the exercise. Means it should not be so heavy exercise beyond his strength he can't perform the exercise. So if he performs exercise means certainly definitely it's going to affect his health. So one way this vyayam shakti pariksha, it helps us to assess the power of the individual, any individual, healthy individual or a patient, and also help us to advise those patients or those healthy individual what are the exercises he can perform in his daily routine. It's not like lifting something heavy weight, that cannot be considered as exercise only. Like there are different things which are there which we can understand if we go through various types of exercise which are explained in our text. Then coming on to the other aspects of this vyayama shakti. So Vyayama Shakti, again it depends whether the person is having sedentary job or sitting in some corner and writing throughout the day. Definitely they will not have any physical exercise. So again they are prone for so many lifestyle disorders, like it may be diabetes mellitus or hypertension or obesity. Then while performing or advising any person whether these exercise can be done or not, we need to know the degree of nutrition. So the power of a person should be assessed before advising any type of exercise to the person. Then here see athletes, if they generally they'll have to perform, they'll have a good strength. If the person athlete is having tiredness for running only few meters, then we have to categorize him as avara shakti person. And stula person, it's very well understood that he cannot run some distance because naturally he'll be having lesser strength. The last one here is vaya pariksha. So here, a vaya, that is nothing but age. Age of a person has to be evaluated or assessed, because there are different features which we can elicit among different aged people. So when it comes to vaya, it is categorized into three. They are balyavastha, we recognize it as child age. Then madhyamavastha, that is middle aged people. Then vruddhavastha, that is old aged people. So this balyavastha, that is, it can be considered from first day to 30 years. This balyavastha in Ayurveda, they are categorized into two, saying aparipakva dhatu, that is from 1 day to 16 years of his or her age. Then vivardhamana dhatu, that is 16 to 30 years. Then middle age, madhyamavastha, vruddhavastha, that is uh, old age. Okay, so what are the things which are there to know under these headings? One is under balyavastha, aparipakva avastha is told. That means organs of the body are not developed. There will be presence of tenderness among the person. Then the individual cannot tolerate any difficulties because it is aparipakva avastha. The person will have lesser strength, dominance of kapha dosha will be there. That means 1 day to 16 years of the life. Then vivardhamana avastha. So that is from 16 years to 30 years of one's age. We categorize it as developing stage. So dhatu are in growing stage. So in this age, no, the dhatu, that is tissue, is in growing stage. Again, mental faculties are not completely developed. That is also very important point we need to have in our mind when we are asking or assessing any person who is having this balya or child. Madhyamavastha, we know it is regarding middle age. There are very good things which are explained in this. They're having very good strength, or they may have a very good energy. So with valor they'll work. They'll have very good power of understanding. They'll have good memory. They'll have very good retention power. The middle-aged people will have very good ability to speak and analyze the facts. During this age, there will be dominance of pitta. Okay, again helps us to assess if the person is having, or his age falls under middle age, then we can predict the person may have pitta related diseases commonly. So balyavastha, it is kapha which is dominant. So the people, or the child who is in balyavastha, definitely will have kapha related diseases. Vruddhavastha, old age, the person will have there will be diminution of all the dhatu. The person will have a comparatively less strength in his sense organs. There will be less energy. Again, diminution of power of understanding. The person may lose memory. There will be very less analyzing capacity. In this age, there is dominancy of vata dosha. So it helps us to predict, okay, the person is very commonly prone for vata related diseases. Um, in this age, for example, the certain diseases are very common among particular age. When it comes to old age, it is sandhivata. We call it as osteoarthritis, and any type of vata vyadhi. It is very common among the people who is in old age. And the same thing like dyspnea, or difficulty in breathing, or any respiratory diseases, which are very common among the children who is aged till 16 and 30 also. Now, coming to the relevance of these Dasa Vidha Pariksha. So, what is the relevance? Why we need to do all those things? So, we have learned the 10 factors which are mentioned in our classical text. So, those are the parameters to assess various factors in an healthy individual, or it may be among patients. Dashavida Pariksha is highly appreciated when it comes to assessing the strength of the person or the patient. So, why we need to assess strength of a person? So, there are various things which are involved when it comes to strength. The strength is also very important for us to assess, okay, whether the person can withstand the any difficult situation. That is one very important factor. Then we can, it also help us to decide the dose of any particular formulation which we are going to administer. Or if a person is having good strength, if he is healthy, means he can lead a very good life, right? So if the person is having very less strength, then we need to advise the person like how he can improve his health by adopting good food intake, or by following good daily routine, or by having or by consuming some of the very important safe medicines which is helping him to improve his strength. So all those things are very important for us to advise to the person or any patient. That's why we need to assess health strength of the person. Then why we need to assess the strength of the disease. So here we have learned that there are different factors which are involved when it comes to assessing the strength of any particular disease. So here, if the disease is very strong, right? So, or where various doshas which are vitiated are very strong, then it helps us to decide, okay, what type of treatment can be planned, what is the prognosis of the disease, or what is the exact treatment which can be planned with, what is the panchakarma therapy which can be advised, or what are the medicines which can be advised to the person. All those things can be planned when we assess the strength of the vyadhi. So that is the second factor which we are assessing. Then this Dashavida Pariksha is very relevant because it helps us to decide the prognosis of the disease. Here, if there are the disease is having so much dosha vitiation, all the dhatus which are involved in our, like deep-seated dhatus which are involved in it, so then it goes towards bad prognosis. Okay, so if the, even though disease is very strong, but the person is having very good strength, then it is a positive prognosis. It can be good prognosis because he can overcome the strength of the disease. So when we are balancing, if the strength of the disease is more, definitely the prognosis goes towards bad. So if the strength of the person is very strong, then the prognosis goes to good. Okay, that is the importance of this Dashavida Pariksha. Then one more very important thing is planning line of treatment, because in our Ayurveda, when we take an example of any particular disease, it's very clearly told the Panchakarma procedures are for the person who is having better strength, right? For example, emetic therapy, the person who is having very less strength, he cannot tolerate the strength or potency of the medicine which is administered when it comes to emetic therapy. So it may cause so many harmful outcomes. That's why it's very important to assess all these 10 factors to plan any particular treatment. Then deciding the dose of medication. This is very important thing here we need to know, because if a person is having very good strength, then you are administering very less potency drug, then the drug may not show any action at all. So then the desired result may not come. But on the contrary, if a person is having very less strength, you are administering such medicines which are very strong in nature, then definitely it is again going to cause so many problems. So then, knowing the lifespan of the patient. So again, if a person is having a good strength, we can easily predict, okay, the person will live for long. If all these Dashavida Pariksha or 10 factors which are in optimum level in any healthy individual, definitely that individual live long, because all these 10 factors are very strong in nature or very high, then definitely the person is going to have very good lifespan. Then let us know 3 or 4 examples why we need to learn about these Dashavida Parikshas. A 34 years old individual having dominancy of Pitta Kapha, having headache on exposure to sunlight, he'll have vitiation of Pitta dosha. He needs a very strong medicine. Then example 2 here. So the 37-year-old male patient with Pitta Vata Prakriti from South India, having occupation which is related to traveling long distances in North India, habit of fried items and food prepared from mustard oil, definitely he'll have vitiation of Pitta dosha. Then example 3, that is Sara Pariksha. So here one example is two people of 30 years where one individual with Vata Kapha Prakriti and another with Pitta Kapha Prakriti having the practice of eating fried rice for 6 months continuously. The one person will develop skin disease and other will not be attributed to having other will not have the skin disease which is attributed to Raktasara, means the first individual have Raktasarata. Coming to the conclusion, so these Dashavida Pariksha, which are the 10 unique assessment parameters to evaluate strength of a person or it may be a disease, assessing the prognosis, planning the treatment, and especially deciding the dose is very important factor. All these 10 factors needs to be assessed in each and every individual. So the status of health of an individual which can be evaluated with the help of this Dashavida Pariksha. So these parameters can be effectively applied among healthy individuals also, not only in among the person who is suffering with disease. So the result of these all 10 factors points towards pravara, that is strong, which indicates good strength and better prognosis. And madhyama points at moderate strength, and avara definitely indicates poor and less strength. That's why these 10 factors, what we call it as Dashavida Pariksha, is very, very important parameter to assess health of an individual who may be healthy, or it's very important among diseased people, which also help us to plan the treatment or also help us to know about prognosis. With this, I would like to conclude that know your health today for better tomorrow. So with this, I conclude. I thank the organizers for giving me this opportunity. Thank you so much. I would like to thank Dr. Archana and Dr. Vinit for giving me this opportunity, and High Commission of India, Nehru Center, London. Thank you so much.